next section on the core values and principles and tenets and framework, I'd like to focus on the whole idea of prevention, specifically primary, secondary, and tertiary prevention. And this website really does a nice job of showing kind of the relationship between them. Specifically, they have outlined the kinds of things that are included for each of those. If you're new to the idea of prevention, basically what prevention looks at is preventing future harm or more disease or more harm than has already happened. In primary prevention, no disease has yet occurred. And so these are healthy individuals. They do not have illness or sickness of any kind that's related to that specific preventive area. And so the kinds of things that fall in this area are things like immunizations or health promotion, eating well, exercising regularly, those kinds of things. It could even include wearing seatbelts, injury prevention, those kinds of things. And so primary prevention is among well people. Secondary prevention is interesting because based on secondary prevention, that the concept here is that the person already has the disease, but they don't have any symptoms yet. So it might be that a person does have cancer, but it's not grown large enough for them to become aware of it. Or maybe they do have some kind of other illness and they just have never been tested. Maybe they have diabetes and they are not aware yet. And so the biggest area within secondary prevention is screening. You're going to have a whole entire module on screening and understanding screening. And so screening is right here, secondary prevention. And so that's kind of a big area in public health, is offering screening, catching those diseases early so that they can be treated. And that's also a key piece of secondary prevention. If we find something but don't have any way to mitigate that or make it any better, then there really was no positive effect of finding it earlier, except for making people very worried. So secondary prevention really includes both of those things, where we need to find disease that exists before the person has symptoms, but then also having some way of treating that so that it's possible to slow it or halt that progress. Tertiary prevention really is aimed at people who already have had the effects of a specific disease. Maybe they've had a heart attack or a stroke. And what you'll notice in terms of tertiary prevention is we don't want those things to cause something even worse to happen. And so a lot of times, if you've been involved in a situation where one of your loved ones or someone that you know has had a stroke or a heart attack, what you'll see is that rehabilitation comes in. Often they're one of the first people that patient will see from the hospital. And so we start rehabilitation right away. We want to prevent people from getting the inability to do certain functions that they would be able to do once they recover from that heart attack or stroke. Sometimes people, their limbs may become contracted, and so even though the effects of the stroke have worn off, or become improved, then they still are not able to function at their fullest because of not intervening early. So that's tertiary prevention, somebody who has symptomatic disease that we want to prevent from getting worse, or we want to maximize their ability to function. Here again is that whole idea of going upstream and really taking that on the community level, on the policy level, and so not just targeting these preventions to the individual, but also allowing us to work on a higher level so that we can have the greatest impact possible. The second thing that I'd like to point out is this whole idea of the life course approach. Now, if you Google life course approach, you'll get a lot of different ideas about what exactly that means. I don't think that it's very solidified, but the part of the idea of the life course approach is to think about healthcare needs and services in terms of their place as a person goes through their life, and also specifically the effect of these early life events in shaping an individual's health trajectory. This can be thought of as their health expectation. How healthy do you expect to be in life? And so a lot of times this life course approach does take on those higher levels of community and policy, socioeconomic factors, toxic environmental exposures, things that a person can be exposed to throughout their life that really have an impact on them as they progress through life. So an exposure early in life in elementary or adolescence can have a long-term effect on their health later on. And so the life course approach or the life course model is really something that is an important way of thinking about public health. There are a number of other resources here that you could get a little bit more of an idea of that. And so think about prevention, primary, secondary, and tertiary. Prevention is one of the primary things that we think about in public health, so preventing disease that hasn't happened. And then also this life course approach in terms of how early exposures really impact somebody later in their life.